What is hemorrhagic stroke on a brain scan? Imagine a sudden burst of blood inside the brain, causing damage and pressure. That's what a hemorrhagic stroke is. It happens when a blood vessel in the brain breaks open, leading to bleeding. To see this on a brain scan, doctors often use computed tomography scans, or CORT scans, and magnetic resonance imaging, or MRI. These images help identify where and how much bleeding has occurred, which is vital for diagnosis and treatment. On a CORT scan, a hemorrhagic stroke appears as a bright or white area called a hyperdense region. This brightness is because fresh blood is denser than the surrounding brain tissue, making it stand out immediately after the bleed happens. The size of this bright spot shows how much blood has leaked into the brain. Sometimes, there is swelling around the bleeding site, which shows up as darker or hypodense areas. This swelling can put pressure on nearby brain structures, causing further problems. MRI scans are also useful, especially in later stages or for more detailed views. They can help identify the cause of the bleeding, such as blood vessel abnormalities or tumors. MRI images provide multiple angles of the brain, giving doctors a clearer picture of the damage and potential complications. Key signs of a hemorrhagic stroke on imaging include the hyperdense area representing the blood, the surrounding swelling or edema, and signs of pressure effects like midline shift, where the brain shifts from its normal position. Sometimes, the scan shows signs of ongoing bleeding or hematoma expansion, which can worsen the patient's condition. Recognizing these features quickly is essential because they influence treatment decisions. For example, if a hemorrhage is detected early on a CORT scan, doctors can avoid treatments that might worsen bleeding, such as clot-busting medications. Instead, they focus on controlling the bleeding, reducing pressure, and preventing further damage. Imaging also helps monitor for complications like brain swelling or additional bleeding, guiding interventions to improve outcomes. In summary, a hemorrhagic stroke on a brain scan is mainly identified by a bright, dense area indicating blood accumulation. The size, location, and effects seen on the scan are critical for diagnosis and planning treatment. Accurate imaging allows healthcare providers to act swiftly, helping to prevent further injury and improve recovery chances. Always remember, if you or someone else shows signs of a stroke, immediate medical attention is crucial. Consulting healthcare professionals ensures the best care tailored to individual needs.